County Building City Council Chambers located at 1 Macomb Drive, or watch live on Channel 8 through live streaming on Bloomfield's website. The public may also participate in public comment either in person or by calling 855-695-3744 and pressing *3 to be placed in the queue for comment. The special meeting of the City Council is called to order. Will the clerk please call the roll?
Anderson. Here. Cohen.
Here.
Hinkle. Here. Jezierski.
Here.
Leslie.
Here.
Lamb.
No.
No. Okay. Lindstedt.
Here.
Marshallson.
Here.
Schaff.
Here.
Ward.
Here.
Thank you. A quorum is present. The first and only item for council consideration for this special meeting is the request for an executive session. Will the clerk please read agenda item 2A by title?
Request for executive session related to ongoing negotiations regarding Extraction Oil and Gas Inc.'s operations.
We will now proceed with public comment. Does any member of the public who are in person have comments on this agenda item? Seeing none. Next is public comment from individuals on the phone, and I'm seeing none there as well. Does any member of council have comments on this agenda item? Seeing none. Before I ask the city and county attorney to read the recommended motion, I want to remind council that votes to go into executive session require a 2/3 vote of the quorum present. Will the city and county attorney please read the motion?
That an executive session be held on December 7th, 2021 at council's special meeting for the purpose of receiving legal advice and discussing negotiations regarding the operator agreement for extraction oil and gas and future operations as permitted by CRS 24-6-402 sub 4B and E.
Thank you. Is there a motion? Councilmember Schaaf?
So moved.
Is there a second? Councilmember Anderson?
Second.
Thank you. Is there any discussion? Before we have council member appearing remotely, because we have a council member appearing remotely, we will use a roll call vote. Will the clerk please call the roll?
Anderson.
Yes.
Cohen.
Yes.
Hinkle. Yes. Jezierski.
Yes.
Leslie.
Yes.
Lamb. Lindstedt.
Yes.
Marshallson.
Yes.
Schaff.
Yes.
Ward.
Yes.
Thank you. That passes unanimously. Council has approved the request to move into an executive session. I want to reassure the public that no formal decisions can be made in the executive session, including approving changes to any contract. That concludes the item on this evening's agenda. Is there any other business to come before council? There being no further business, council will convene the executive session momentarily in the conference room. If need be, the executive session will continue after the conclusion of the regular council meeting. The special meeting will adjourn at the conclusion of the executive session. The regular council meeting, also scheduled for this evening, will begin around 6 p.m. Thank you. Okay, I bet you on that one.
The Access Live event is in music hold.
No, go ahead. I'll follow you guys. Good evening. Good evening. Did you happen to find any water bottles in there? No. Okay. I logged mine. I'll see if I'll ask Kelly if she's done any.
The Access Live event has ended. Thank you for calling. Goodbye. Music hold ended.
Hi, Tia. This is Jake just doing another sound check. Can you hear me okay?
Yes, you're good to go. Sounds clear.
Thank you so much.
All right, thanks.
Welcome to tonight's City Council meeting. The public can attend tonight's meeting in person at the George Cicero City and County Building Council Chambers located at Wendacombe Drive, or watch live on Channel 8 through live streaming on Brookfield's website. The public may also participate in public comment either in person or by calling 855-695-3744 and pressing *3 to be placed in the queue for comment. Please note that if you're calling in for public comment and would like to speak on more than one item on tonight's agenda, you'll need to press *3 each time to be placed back in the queue for comment. Public comment will be limited to 90 minutes total per item. The first 1 through 15 participants in the queue have 3 minutes to speak. The next 16 through 25 participants have 2 minutes to speak. And if time remains, the next 26 plus participants in the queue have 1.5 minutes to speak. Again, if joining virtually for public comment, the number is 855-695-3744 and press *3 to be placed in the queue. Screeners will ask callers for their first and last name, neighborhood, and the agenda item the caller would like to comment on. Please call several minutes before the agenda item and press *3 to ensure you're in the queue for comment. If joining in person, we'll ask you to come to the podium and state your name and neighborhood for the record. The City Council regular meeting is called to order. Will the clerk please call the roll?
Anderson. Here. Cullen.
Here.
Hinkle. Here. Jaworski.
Here.
Leslie.
Here.
Lim.
Here.
Linsett.
Here.
Marsh Fulton.
Here.
Schaff.
Here.
Ward.
Here.
Thank you. A quorum is present. Will everyone please rise and join me for the pledge of allegiance?
One nation, under God, indivisible, with liberty and justice for all.
In an effort to keep order for tonight's meeting, I ask council members to limit their comments to 5 minutes. Abby will be assisting with the time keeping. Additionally, please remember council rules of procedure regarding conduct. When possible, council member comments and communications should be limited to 5 minutes per individual per item. If council members are given an opportunity to speak for a second time, they should limit their comments to 2 minutes. We will plan on a 10-minute break at approximately 8 p.m. We will begin with council's review and approval of this evening's agenda. Council may add or remove items from the consent agenda, or council may revise the order of business for the meeting. Does any member of the council have any comments or questions regarding this evening's agenda? Seeing none, are there any objections to this agenda being approved? Seeing none, this agenda is approved. There are no petitions or communications this evening, and we will move to public comment next. This is an opportunity for the public to comment on matters other than the items already listed on this evening's agenda. As mentioned earlier, the public may comment both in person or via phone. If you're joining via phone and want to be placed in the queue for comment, please call 855-695-3744 and press *3. If you're joining in person, please line up at the podium. Public comments will be limited to the time limit outlined earlier. I don't see any general public comments. So moving on, council's community and event updates are next. Does any member of council have an update this evening? Councilmember Schaff.
Thank you, Mayor. So today is Colorado Gives Day. You have until 12 o'clock tonight to donate to one of the many Colorado nonprofits, and your donation will be doubled as well, and you'll be contributing to a day of giving. So if you have not given to a local nonprofit in Colorado by 12 midnight tonight, please do so. Thanks.
Thank you. Any other council member updates? All right. I think there's no way that you can avoid knowing that today is Colorado Gives Day. Just in case you didn't check your email. Anyway, council's consideration of the consent agenda is next. We'll review this evening's consent agenda in two parts, as site item 7E is a request for an executive session and requires an individual motion. Following the first reading of consent agenda items 7A through 7D and 7F, we will ask for public comment. Will the clerk please read agenda items 7A through 7D and 7F by title?
Approval of minutes from regular meeting of November 9th, 2021 and November 16th, 2021. Resolution number 2021-193, authorizing and approving a second amendment to the consulting agreement by and between the City and County of Broomfield and Burns and McDonald Engineering Company, Inc. for the LAC Black Femora Lift Station Site Application and Rehabilitation Project. Resolution number 2021-198, authorizing and approving a consulting agreement by and between the City and County of Broomfield and BHA Designs, Inc. for the Broomfield Bay Renovation Phase 4 project. Resolution number 2021-201, authorizing and approving an agreement by and between the City and County of Broomfield and AB Tech Electronics, Inc. for equipment purchase, installation, and repair services for the City and County vehicles. Resolution number 2021-166, approving and authorizing an intergovernmental agreement by and between the City and County of Broomfield and the Board of County Commissioners of Adams County for coroner services.
Thank you. We will now proceed with public comment. Does any member of the public have comments on these agenda items? I don't see any online for this, so does any member of council have comments on these agenda items? Councilmember Stratt?
Thank you, Mayor. So this is questions about 7F, the IGA with the coroner and Adams County commissioners. So in the past year and a half, we've had the opportunity to go on a tour. Some of us on council have had to go on a tour and have a better in-depth conversation with the Adams County coroner. This agreement that we have before us is very different than we've seen in the last 3 years. We've mostly just kind of seen a reauthorization of that original contract that we had with Adams County coroner. But this is different. And so what we have before us tonight is a separate agreement with Adams County, and then we also have an agreement with the Adams County coroner, and this is very different. So can you tell us a little bit about why we have two agreements as opposed to just one?
Yeah, absolutely. And subsequent, so as you mentioned, Councilmember Schaaf, over the last year, the relationship in the past with the Adams County coroner primarily has been with PD, quite frankly. And from a staff perspective, the mayor and I we have begun to really develop that relationship with Ms. Brancucci as well as with her deputy. And part of that, after the tour, if you will, and the in-depth conversation, there are several examples that in the past, even though with an intergovernmental agreement, Broomfield has not paid its way. And this was one of those examples. So part of the capitalizing on existing facilities. So there was the component on one of the agreements is ensuring that with the cost and increase that Adams County nor Ms. Brancucci has ever come back and had any kind of increase. It was always per body, not to get too, yeah, thank you, Councilmember Hinkle. But we did not have any discussion about COVID-related PPE or the complexity of cases or the increase of costs for their staff. And so Ms. Brancucci, being an elected official, is separate from the general staff. And so their staff, like ours, receives annual increases and has insurance and all of those other employee benefit packages. Ms. Brancucci does not. That said, the level of expertise when working on one of our deceased isn't different from one of their deceased. So we looked at the statute. Ms. Rogers and I have had several conversations with Ms. Brancucci after the mayor and I established that relationship. And this was the most equitable way moving forward And it's in alignment with how we've been paying the DAs since we became a city and county. And that is based on population. So rather than having two separate kind of philosophical approaches, basing it on population, which is 12.2% for the overall operations, will, as we move forward, continue to be that natural increase. Per statute, the coroner is paid much like county commissioners are paid. It's a tiered approach, and that's set by statute by the legislature. So we looked at a similar comparison where we would be, and where if we were a standalone, which is something that we looked at, what we would be paying Ms. Brancucci strictly for our deceased only. That's the amount that you all are agreeing that I enter into with her via a separate agreement. This is, again, the most equitable way moving forward. As our population increases, one of the things that we took into account was we're the fastest growing county in the state of Colorado. And that puts pressure on not only on us internally, but certainly on our partners for the IGA that we capitalize on. So we're confident and comfortable in this structure moving forward, and we look forward to deepening that relationship outside of the PD. The coroners have been a very crucial partner for us.
So while we're going to take a hit this year, in the years following, there's going to be more of a kind of a smoothing effect in that there won't be these big jumps that we'll expect to see. According to our population, I guess if we have a population increase, major population increase, we'll see a big jump. But hopefully we won't see as big of a jump as we're right now. You mentioned the idea of paying our fair share, and I think that's a criticism that Broomfield has received before, whether it's a project or whether it's an agreement that we've had. So how do both Broomfield as well as Adams County and especially the coroner believe that this is Broomfield paying its fair share with regards to our services that we are going to be receiving?
I certainly believe so. Councilmember Schaaf, generally when you're paying your fair share, oftentimes you don't have your partner say, good job, you're paying your fair share. It's only when you're not paying your fair share that your partners make that indication. So I think it's, again, not only did we work with Ms. Brancucci, but Ms. Rogers was in pretty constant contact with their CFO and their attorneys as well. So again, it's a partnership and relationships that we haven't had in the past that we have now. I do want to mention, and if Commissioner Odoricio is listening, he'll probably be reaching out to the mayor if I didn't mention. So they are building a new building, a state-of-the-art facility, and they're busting at the seams. So we do anticipate coming back to council with a percentage of contribution for that new building when those schematics are defined and confirmed.
Well, it sounds like there's some cost to cover there for Adams County, and with our population will help to contribute to those costs. So thank you for that. Thank you, Mayor.
You're welcome. Any other council member comments? Great work. Before asking for a motion, I want to remind everyone that item 7F is an intergovernmental agreement and requires 2/3 approval of council. Is there a motion that the recommendations contained in the staff reports for agenda items 7A through 7D and 7F be approved? Councilmember Leslie? Is there a second? Councilmember Ward?
So moved.
Thank you. Well, you're the second. Again. Thank you. Is there any discussion? Councilmember Lim is joining virtually, so we're going to do a roll call vote. Will the clerk please call the roll?
Anderson?
Yes.
Cohen?
Yes.
Hinkle?
Yes.
Jazerski?
Yes.
Leslie?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Marshall?
Yes.
Schaaf?
Yes.
Ward?
Yes.
That passes unanimously. Next is council's consideration of consent agenda item 7E, a request for an executive session. Following the first reading of consent agenda item 7E, we'll ask for public comment. Will the clerk please read agenda item 7E by title?
Motion for executive session for the purpose of providing legal advice and obtaining instruction to negotiators regarding case number 21-CB-B-2-671 PAB NYW Bickford versus City and County of Broomfield.
Thank you. We'll now proceed with public comment. Does any member of the public have comments on this agenda item? Not seeing any. Does any member of council have comments on this agenda item? Seeing none, will the city and county attorney please read the motion?
That an executive session be held on December 14th, 2021, prior to council's regular meeting for the purpose of providing legal advice and instruction to negotiators regarding case number 21-CB-02671 PAB NYW Bickford versus City and County of Broomfield.
Thank you. Is there a motion? Councilmember Leslie? Is there a second? Councilmember Stratt?
Second.
Thank you. Will the clerk, or is there any discussion? Will the clerk please call the roll?
Cohen,
Yes.
Hinkle. Yes. Jezerski,
Yes.
Leslie,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Marshallson,
Yes.
Schaff,
Yes.
Ward,
Yes.
Anderson.
Thank you. That passes unanimously. We have one item for the Board of Social Services consideration this evening. Proposed resolution number 2021-175-DSS, acknowledging a review of expenditures and electronic benefit transfers for July, August, and September 2021. The meeting of the Board of Social Services is called to order. I'll ask the clerk to please call the roll.
Anderson. Here. Cohen.
Here.
Hinkle. Here. Jezerski.
Here.
Leslie.
Here.
Lim.
Yes. Here.
Here.
Marshallson.
Here.
Schaff.
Here.
Ward.
Here.
Thank you. A quorum is present. Board members have a copy of the agenda memorandum, which I'll ask our staff to summarize.
Thank you, Mayor. Dan Casey, Director of Human Services, will provide us a brief overview and field any questions. Mr. Casey.
Thank you, Manager Hoffman. Good evening, Mayor, Mayor Pro Tem, and members of council. I'm Dan Casey. I'm the Director of Human Services. And I will briefly highlight some of the topics in the memo that you guys were provided for the EBT expenditures for the third quarter of this fiscal year, this city fiscal year. One thing I wanted to start with is oftentimes when we read these reports, I would ask you to keep in mind that we work on 3 separate fiscal years. One is our state fiscal year, which the bulk of our funding is through the state allocations, and that is July through June. That's the state fiscal year. The federal fiscal year is October through September, and then our city fiscal year is a calendar year, January through December. So Danita Dye, who's here today, is our awesome operations manager, and she has to keep all of that stuff straight and keep it all coordinated. So oftentimes when we provide the EBT reports, you'll see that maybe we look like it's overspent or underspent based on our calendar year, our CCOB calendar year. But a lot of times those catch up because we're getting additional allocations. We have additional expenditures. So you'll see on the particular report for this evening that we're about 93% of where we should be. You would expect to be in the third quarter about 75%, but we've got a number of outside fund awards that we have submitted to our budget office, and those dollars will follow, so that catches it up. So it appears as though the numbers are a little wonky just because of how we report. A couple of things I want to highlight. One is our TANF expenditures are down about 25%. That's our temporary aid for needy families. We attribute that to a lot of people out of work right now and collecting unemployment benefits that otherwise impact their eligibility requirements. So we anticipated that our TANF dollars would go down a little bit. Our SNAP, which is our Supplemental Nutrition Assistance Program, or food assistance is more commonly referred to, that's up about 13%, and that's been consistent over the last, 18, 24 months. And those are allocations that are provided for folks to receive nutritional meals, EBT cards. They can get food, groceries, other household items. Medicaid has also gone up about 17%. I think that's a product of the environment we're in now with the pandemic, and that's good to see. And then CCAP, which is our Colorado Child Care Assistance Program, we're up about 9% in that program as well. So overall, across our programs, we're up about 10% from the same point last year. And I think the last thing that I want to talk about is Medicaid right now is what I've referred to previously in other meetings. We're in a locked-in period. So the federal government put anybody that was in a Medicaid program, they left them enrolled in that program through the public health emergency, and they made some categorical eligibility requirements. So we have more folks in Medicaid now that are locked in that may not normally have been eligible. Our team is working very diligently, so when the public health emergency ends, we can address those cases, make sure that they're still eligible for the program, or back them off of those programs if they're no longer eligible. That's going to require quite a bit of additional work, and this body approved the budget. We're getting about $78,000 from the state to use for overtime or for additional workload. That's a pot of money we can use. If we don't use it, we can revert that back to the state. And as of today, I'm happy to report that we are very comfortable and feeling pretty caught up on our locked-in report. So hopefully we won't have to tap too much into those dollars that were awarded to us. And that concludes my presentation, and I will answer any questions.
Thank you, Mr. Casey. We'll now proceed with public comment. Starting with in-person public comment. If you'd like to be heard, please come to the podium and state your name and neighborhood for the record. And there are none online either. So questions from the board are next. Are there any comments or questions from the board? Councilmember Hinkle.
Thank you, Mayor. Thank you, Mr. Casey, for coming up today. This is just an appreciation comment. I just want everyone to know that the resettlement agencies that are resettling our Afghan evacuees have commented over and over and over at how well and how quickly our clients are, approved through our systems. We have people that are still waiting in Jeffco for almost over a month to receive these EBT cards, to receive a lot of different things. And so I just wanted to comment that you guys are doing a fantastic job. And I can see it firsthand with these EBT cards too. Even though a lot of these families are in housing, they don't have access to food, to go fish, they don't have transportation. And so with the EBT card, they can access food close by. And I feel like that's super important. Particularly, we have another family of 15 coming into Burnfield, and they survived the blast in Kabul. And it's going to be very important because transportation is going to be very difficult. So what you do day in and day out, I just want to tell you and your staff are doing a phenomenal job. And then the question is, going back to the $70,000, you said that you guys aren't planning on tapping into that, or there's no inclination that you guys will need that.
Yeah, thanks for the question, Councilmember Hinkle. The state asked us to provide them a plan that we felt would keep us up to speed on that locked-in report. We provided that plan to them a few months back. Our estimate at the time was about $70,000. They came back to us and said, hey, we'll give you 78. That was before we were working a lot of the locked-in report activities. So 78 would be the worst case scenario if we had to use overtime and we had to pay staff extra time to work the volume of workload required because of the locked-in report. At this point right now, I think we're probably going to be about half of that, or maybe 50,000, just best guess estimates as of right now.
Okay, thank you. And then the leftovers given back to the state, is that correct?
Yeah, and I should, it's actually an allocation, so we don't get a check for $78,000. We get reimbursed for the activities that we report back to the state that we're doing. So it's kind of a fee, almost like a billable time. So we don't have a check sitting here. We have to write a check back to the state. They just don't pay us for what we don't use.
Okay, perfect. Thank you very much.
Any other council member comments or questions? All right, well, thank you very much for the update, Mr. Casey. We have to, next is the board's consideration of proposed resolution number 2021-006, 175-BSS. Will the clerk please read proposed resolution number 2021-175-BSS by title?
Resolution number 2021-175-BSS, acknowledging review of expenditures and electronic benefit transfers for July, August, and September 2021.
Thank you. Is there a motion? Councilmember Shaw?
Thank you, Mayor. I move that resolution number 2021-175-BSS be adopted.
Thank you. Is there a second? Councilmember Ward?
Second.
Thank you. Is there any discussion? Will the clerk please call the roll?
Hinkle? Yes. Mazursky?
Yes.
Leslie?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Marshall?
Yes.
Schaff?
Yes.
Ward?
Yes.
Anderson?
Yes.
Cohen?
Yes.
Thank you. That passes unanimously. Seeing there's no further business before the Board of Social Services, the meeting is adjourned. Next, this evening, we have two items for the Board of Health review. The meeting of the Board of Health is called to order. I'll ask the clerk to call the roll of the Board of Health.
Anderson? Here. Cohen?
Here.
Hinkle? Here. Jazersky?
Here.
Leslie?
Here.
Lim?
Here.
Lindstedt?
Here.
Marshall?
Here.
Schaff?
Here.
Ward?
Here.
Thank you. A quorum is present. The first item for the Board of Health this evening is the COVID-19 update. Board members have a copy of the agenda memorandum, which I'll ask our staff to summarize.
Thank you again, Mayor. Jason Balling, Director of Public Health, and Deb Fetterspill, Deputy Director of Public Health, is also here to walk us through COVID. Lots happening, Jason. Help us understand what's going on.
Yes, good evening, Mayor and council members, or I should say Board of Health members. As you've seen in the news, we have a new variant that's emerged out of South Africa, the Omicron variant. We're tracking this very closely, both at the World Health Organization, Centers for Disease Control and Prevention, and then also across the United States. I'm sure you have heard that we have 2 cases here in Colorado. One of those cases was out of Arapahoe County, and the reason that was identified is it was somebody that had traveled to Africa and had traveled back, and through the contact tracing that we do in public health, we were able to flag that person to have their test sample done through the genomic sequencing through the lab, and that's how that was identified. Additionally, we had a case in Boulder as well. We do believe it's going to continue to spread across the United States. We don't think it's going to be just these isolated cases. That will occur through the detection systems we have in place. As I mentioned before, we have surveillance systems, genomic sequencing that takes place through our state lab. Colorado is a leader in this. We take over 15% of our samples and do that sequencing. That's a significant number of sampling to determine whether or not we're seeing the variant. The other thing that we have is wastewater surveillance or sampling, and Broomfield is actually participating in this program, which is wonderful. And what we see through that is potential viral shedding from the variant, which could be identified. And we're looking at that as an early warning detection system to see, are we seeing not just 1 or 2 cases, but more cases in the community, which then can lead to more mitigation steps that need to take place. A couple other things, and I saw Dr. Fauci's presentation today as part of the COVID White House task force briefing. There's a lot that we don't know, but we're suspecting of what may occur with this variant. One is looking at transmissibility. What they're seeing in Africa is the potential for increased transmissibility, and they're looking at the reproductive rate or effective rate. That's the R naught we often talk about, how you expose it to others.
They are seeing it spread quickly through South Africa, but it's a population that's way less vaccinated than the United States. So that can be playing into it. The other thing they're looking at is what's the level of severity of this. And based on the initial cases they're seeing out of South Africa, the symptoms look less severe than what we're seeing with Delta. That being said, there's a lot more data that needs to be collected. So all of this is taken with a word of caution and science, and more data needs to be collected in the next couple of weeks. And then lastly, we want to see how the vaccines work against this. Everything that we know about the vaccines, and also if you get the booster shot, is they're highly effective against the variants. The experts are expecting that to hold true, but we'll see how that plays out. And what they do is they take the actual virus in a lab setting and see how it performs with somebody that's been vaccinated, take their blood sample and see how that works. So, well, long story short, more information to come. I know it's scary when we hear the initial or that we have another variant that's out there, and there's been a lot of news coverage around it. But we have a lot of the tools in place that we need to just keep practicing to get us through this. And they're the ones that we've been promoting throughout. Get your vaccine, get a booster shot, definitely if you can. Wear a mask in indoor public spaces. Limit your gathering sizes. Wash your hands, practice social distancing, and get tested if you feel like you have symptoms. The other thing for the Broomfield specific information is we continue to do extremely well with our vaccines. We have 71% of our total population that's fully vaccinated. That is, again, one of the highest rates in the entire state. We're right there with Denver and Boulder as far as the highest vaccination rates, other than a lot of the small rural counties. The second thing is that we're seeing over almost 40% of our Broomfield kids have stepped up for their parents in the ages 5 to 11 group to get their first dose. And that's great because we know what that means as we start to look at potentially relaxing mitigation efforts, specifically in specific settings. And if we could get to a place, we've been talking about this in the Metro Denver Partnership for Health, where we get 70% of our school-age children vaccinated, where we see our community transmission go down to a place of 50 cases per 100,000 over a 7-day period, or that we have a period of time that kids have eligibility to the vaccines, that at that point in time we can begin exploring is it should we pull back on public health orders, still recommending the mitigation strategies that we need to have in place. As you all know, we are participating with the rest of the metro region in trying to reduce hospitalizations statewide. We were definitely heading in the wrong direction, and we were at a point where we were projected that we were going to exceed our hospital capacity, which was extremely concerning when we started to talk about crisis standards of care and potentially the rationing of care. Thankfully, we're not to that place. Statewide, we're starting to see hospitalizations level off and decrease, but we're still at a very high number of hospitalizations. And so we're not out of the woods yet. Hospital system is still very stressed. Hospital capacity is still stressed, and we're hoping through what has been done and what we're seeing with some of the decreases in cases that we'll see that carry over into hospitalizations as that lagging measure. Broomfield continues to do really well as far as the rate of our hospitalizations. We have the 8th lowest rate in the state, and that was as of December 1st. And when you look at the total counts of hospitalizations, there's large counties that have significant numbers of hospitalizations. El Paso County of 148 hospitalizations over a 7-day period, whereas in Broomfield, we only have 5. So that sort of illustrates the issue that we're facing statewide with hospitalizations and why a lot of our metro partners stepped up, because even though they have high vaccination rates, they're still seeing a high number of hospitalizations come from their counties. A couple other things is that our monthly hospitalized count is significantly lower this time than last year. So y'all remember when we went through the November, December peak last year, going through it again. And what it's showing is the vaccines are working. You know, last year we had put really strict orders in place on capacity restrictions, etc. Right now, what we're seeing is the community is getting back to living their lives through normal mobility, etc. And even with that, last year we had 53 hospitalizations. This year we have 25. So progress is being made as we're going through this pandemic. And then lastly, that I want to call attention to for council and for the public is, we know hospitalizations work, but what we're seeing is our hospitalizations, and specifically our breakthrough hospitalizations, are occurring in that 70+ population. And that's been our at-risk population through this entire pandemic. So we looked at the month of November data, and we had 16 total hospitalizations in that age group, and 9 were among those that were fully vaccinated. Now, there could be factors playing into that, whether or not they received a booster, which we're going to look into further. Also, if they got the booster, it takes time for the booster to take effect. Or it could be there's other immunocompromising issues happening within those individuals. So again, our recommendation is specifically when you're around this population is follow all of our public health guidance, make sure you mask up, and also that you're protecting those our most vulnerable population. So what we're going to continue to do in Broomfield, and we think this works not only for the short term, but positions us really well for the long term, is continuing to increase our vaccine uptake in that 5 to 11 population. Our goal is to get to 50% by January 31st. I think we're definitely on track to get there as a county, to increase our booster uptake in the 70+ through education and outreach. So even though 70% of that population has received the booster, there's more work to be done. And our initial vaccine rates in that age group were over 98%. So we've been working very closely with Clay Shuck, Senior Services, and Community Engagement to get the word out and to find out what are some of the barriers that may be out there. Are there access issues, or are there other issues, and how can we help that population get their booster shots? And then lastly, looking at the data and looking at what's happening in our surrounding counties, based on our case incidence data, and also based on the hospitalization data, what we're seeing is our current mask order is working. We're not seeing dramatic differences between what's happening in Broomfield versus our surrounding counties that have countywide mask orders. So we're going to encourage what we've been doing. Our residents, what they have done is step up, follow the guidelines, wear your masks in indoor settings. And as we get through the month of December and hopefully see this hospital surge start to turn around, we'll be in a much better place going into the late winter, spring months. And with that, that concludes my presentation. I'm happy to take questions.
Thank you very much, Director Valla. We'll now proceed with public comment. Does any member of the public have comments on this agenda item? If so, in person, please step up to the podium and state your name and neighborhood for the record. You'll have 3 minutes. Seeing none, we'll go online. We do have one caller on the line that would like to comment on this item. So we'll go to you, Mr. Robert Bueller.
Yes, thank you. To the Public Health Department, we need to stop making these public health orders regarding facial coverings, proof of vaccines. It's all just more of the same that obviously has not worked. If there is a hospital strain, it's due to the authoritarian vaccine mandates driving employees out, coupled with the increased patient load, likely due to adverse effects of the vaccine. There's a laundry list of adverse side effects to the vaccine, including death. These health issues manifest in a myriad of diseases. All that, and it doesn't even prevent COVID. Mr. Bolling wants us to give an experimental vaccine to our children and mask infants? We sure this is the health department? The city council. Stop allowing the public health department to keep making up these orders. They discriminate against people who can make their own health decisions. These people can assess their own risks regarding their own health. Put the public health department in check and keep them there. Our county does not have to play victim to their tyranny. It's clear that they are perpetuating a false narrative that is sadly, corporately, and politically motivated. Broomfield can do better than this. Broomfield can do better than tracking cases of insert variant here coronavirus. Bolling was right about one thing. There's a lot he doesn't know. Thank you.
Thank you. I don't see any other public comments, so next is questions from the board. Board Member Cohen.
Thank you, Mayor. I have one question about the variant, but I just wanted to say, I think we need to state for the record, pretty much everything this caller just said is false. This is a very safe and effective vaccine. Over 200 million people have taken it. Most trial periods for new drugs, new vaccines are 3,000 to 5,000 people. In this case, 200 million people have taken it, and we have vast amounts of data to prove that the vaccine is safe and effective and should not be feared. I had a quick question. You mentioned at the very end of your statement about worried about surges. Right now, what we're dealing with is the Delta variant. I was reading that we expect, or health experts are expecting, this the new variant to pretty much hit us or peak in end of January, February. So do you anticipate that, considering it's reportedly far more infectious, however, not perhaps as damaging, I don't know if that's the case for people 70 and older, if that's a younger population, that we may have to reevaluate that toward the end of January, after Christmas?
Thank you, Councilmember Cohen. And first of all, I can agree with you more on the vaccines. We know they're highly effective, and we monitor all the side effects with those. So thank you for that comment. Regarding the variants, we have to see how it's going to play out as far as if it's more transmissible than Delta, and if it starts to overtake Delta to lead to additional surges. And the way that takes place is we track it in our communities, and we start to see, we saw that with Delta when we had the initial Alpha variant from the UK here. And then what we saw over time was Delta took that over. If we start to see that same pattern in the United States or here in Colorado, obviously, we would reassess and determine what's needed. But the other thing that is complete speculation at this point by some of the experts is if the Omicron variant is more transmissible but less severe, you could potentially see it take over, but we could see our hospitalizations decrease. And that's again, data that we'll just have to monitor and see if that truly does play out in the real world or not.
Thank you. And I have one last question about boosters. As I work in the higher education field, we're starting to see some of my institutions require the booster as well, in addition to the regular dose of the vaccine. How available is the booster? I heard different stories as to availability in this community or elsewhere, how easy it is to get, or if there's plans to have clinics.
Yeah,
for the targeted audiences.
thank you for that question as well. That's something that we monitor daily. Our team is reaching out to all of our providers to see what the potential wait times are to get in for boosters. I think what we saw happen, and it's unfortunate, is we had the 5 to 11 age group become eligible. We had the 65 plus that was eligible for boosters, and then it was opened up to 18 plus in Colorado, creating the perfect storm of a lot of people wanting boosters. And what we're hearing from a lot of our pharmacy partners is it's not an issue of vaccine supply. It's an issue of staffing. A lot of them are having a hard time keeping staffing at the pace that's needed to keep rolling out the vaccines. What we've heard recently is 1 week potentially to get in for a booster. At the same time, what we're exploring with our department is, are there ways that we could do clinics specifically for our 65 plus population at the health department, and not looking at doing mass clinics because those really aren't needed yet, but more of those targeted efforts. You're welcome.
Thank you. Councilmember Marshall.
Thank you, Mayor. Director Foley, I want to thank you for everything you've done throughout this entire pandemic. I've only been on council for a short while, but I can imagine that the flack you've taken over the last year and a half has been tremendous, as well as the rest of the council. I want to echo Councilmember Cohen's comment about the dangerous misinformation that gets spread sometimes. Just from a public, example standpoint, my 6-year-old daughter, we just got her second dose of vaccine this week, and looking forward to the time when my 2-year-old can get his vaccine also. And just, it's something we take seriously. My family and I, we usually have a pretty large Christmas party gathering, friends and family, and we decided this year to not do that, even though most of in fact, all our friends that we would have invited would have been vaccinated. But just, because of the danger, we didn't want to go forward with that. I do have a question for you regarding the mask mandate. I am not a public health expert, so I'm going to defer to you on the science. My question is more about the practicalities and the politics of it. What are you hearing from the other counties? Because I've heard from several people that it almost like we left them hanging because everybody was going to move forward with the mask mandate together, and then we decided to not do the full on it. And especially since we're not, it's not like we have walls on our borders. You go to Sprouts and you're in Westminster, Jefferson County, you come across Walmart, you're in Brookville. So what are you hearing from the other counties, and as far as where we go moving forward?
Yeah, so I meet frequently with the executive directors of the public health agencies in those other counties. Actually, they understood the rationale and the reasons we made the decision in Broomfield and respect that. The second part of that is we are continually looking at what we're seeing in those surrounding counties and the potential impact to Broomfield or those other counties as well. What we're seeing through some of the data that's collected through the Colorado School of Public Health and the Facebook, and their modeling data is Facebook does a survey of mask wearing, and what we're seeing in counties that pass the mask order, mask wearing is going up. We're also hypothesizing, unfortunately, Broomfield sample size is so small that that's occurring here because we're seeing it in some other counties that don't have a mask order. The mask wearing is going up. Part of that could be the fact that that statement of we needed an order sent a message out to the entire community that this is needed and we need to take precautions. The other thing that is a little bit unique and different about Broomfield is, again, when we look at our overall community size and vaccination rates, we're in a very different place than those surrounding counties. And so we're going to continue to follow the data. We're going to continue to promote the science. I want to make this extremely clear to everybody. We still recommend people wear masks in all of our buildings. We give them an option. If you're in a room with all fully vaccinated individuals, you could take the masks off, like in that vaccine verification program. But we don't have to necessarily require it through a public health order to make it happen.
Okay. I know from, at least anecdotally, for myself, if I go to Walmart or something like that, I've seen a lot more masks in Broomfield after the order went into effect. The only other question I have is, we as council, we got emails from people saying they're going to come to Broomfield to do their shopping because we don't have a mask order. Are you seeing any, or have you heard of any issues with local businesses when the local businesses are trying to enforce a mask mandate for themselves? Are we seeing any issues with people refusing to comply or?
Yeah, so thankfully, Deb Fetterspill, our deputy director, and Jeff Romine are constantly in communication with the business community. And what they've heard overwhelmingly is that they appreciate that we took this tailored approach in Broomfield, and they are also seeing that there is general compliance in the community. I think one of the challenges with mask orders right now for the entire community, not for specific settings like schools that are more managed, is you could have an order in place, but are you going to have compliance with the order? And we're hearing even from some of our surrounding counties that in certain settings, like a grocery store and others, are seeing increased mask use. But in other settings, the same individuals that don't want to get the vaccine, or don't want to speculate that, same individuals that don't want to wear a mask are not wearing the masks. And so there's not a lot of strong enforcement taking place in those counties around the mask order.
Councilmember Marsh-Holden, if I may, I think not only having high compliance throughout the community and at the businesses, we're at the point now, unless, God forbid something happens with the Omicron, but it's value alignment. And so you will get calls, businesses will get calls, community centers will get calls, libraries will get calls. And if you are wearing your mask, then you will call in advance, and you will frequent, whether it be restaurants or businesses that are in alignment with your values. Same if you don't want to wear a mask. You are not compelled to go to the grocery store or any store, whether it's in Broomfield or anywhere else, if it's not in alignment with your values, not to wear masks. So the components and from the leadership conversations that not only Jason and I are on, but from the city and county manager's perspective, when you implement these mask mandates, everybody turns into policing each other. And that is not a place that we want to go. We don't want residents doing it. We don't want our customers doing it. And we don't want our employees doing it. So the default is wear a mask. But again, from the vaccination mandates, we keep, that trickle effect of mandating our employees to do that. That is not something that we would want to put in place. And we certainly don't want our PD put in any more strenuous positions to be enforcing the mask mandate.
Thank you, ma'am.
You're welcome. Councilmember Anderson. Board member.
Thank you. Okay, so I do have a question about the schools. And this is a question directly from one of my constituents. I thought it would be best to have you answer it yourself here in public. And this was prior to Omicron. So this is especially in light of Omicron variants and uncertainty about the trend of stability and severity. What they want to know is why are the children of Broomfield more protected from COVID at our library and recreation centers than they are at our schools? But they spend the majority of their time. And as our city manager just noted, you can, choose your personal choice of where you shop. This is a different choice. Schools are not an option. And I think the schools right now that are excluded from the mask mandate are the charter and like parochial schools, but yet those are a difficult move to make to bring your child from one school to another school. I think I just want to preface that. So there's still quite a bit of desire to have a full mask mandate in those few schools that are excluded.
Thank you, Councilmember Anderson, and I appreciate the question. As you know, when we passed the public health order for schools, we were one of the first ones in the region, along with Boulder, to pass that order. And we specifically focused in on the 5 to 11 population. And the reason for that was we knew that was the unvaccinated population. Our ultimate goal through this entire order has been to make sure there's no major disruptions in schools. We do track the outbreak data, and what we've continually seen across Broomfield, and this is both in those districts that require the masks all the way up to high school, and in those schools that don't, is we're not seeing outbreaks specifically within that 12 plus population. We have not yet had one. So then it comes back to the second question of, well, what about those schools, the private schools and others that don't have to follow that mandate for 12 plus? What are they doing? They need to still be following the public health order for 5 to 11-year-olds that are masking up. I realize there's operational issues for the schools to have to do that, but we rely on the schools to figure that out. And if it takes the schools having to, if they have mixed grades, mask up others in those grades, that's a perfect solution. So our order is specifically looking at, when you look at how do we protect the most vulnerable populations or communities, that's our focus. I can tell you that we tried to look at case rates between the masked schools and the unmasked schools, specifically in Broomfield. But unfortunately, that data is very limited. Couple reasons for that. When we do our case interviews, we oftentimes find it challenging through the case interviews for the parents to disclose the school. Another thing that occurs this year is schools are not specifically reporting their data to us as a health department. So they're only required to report those cases that we believe might be linked, and that's when we go into that in-depth inspection and investigation to tie it to an outbreak. My own personal opinion, in schools, it's a congregate setting, should be masking all the way. CDC says it's a best practice strategy. I would recommend that schools continue to follow the best practice and strategy. If we do see in the 12 plus population that we're starting to see outbreaks or waning immunity or more cases, we're ready to take action. But at this point, there's no data to point to that.
Okay, thank you for that clarification on there not being any outbreaks and that we are ready to enact a mask mandate. And would there be any benefit to sending a letter out to the schools to say, we haven't done this yet, but this is the recommendation, or are we just expecting them to be paying attention?
Yeah, so that's here, but our schools team is in constant communications with the leadership and principals in these specific schools. We have provided those recommendations. We'll continue to follow up on those recommendations, and we'll, after this meeting, do an additional follow-up email letter saying that is our recommendation, and we're monitoring it closely, and we're ready to take action if need be.
Okay, thank you. That's all the questions I have.
Thank you. Councilmember Shaw, board member.
Thank you, Chair. So I'll try to be quick. So one of the pieces that you had in your slide deck was that we had 5 hospitalizations in the last 7 days. We used to see that as a rolling average. Is that what you meant was a rolling average, or is that seriously 5 hospitalizations in the last 7 days?
That's 5 hospitalizations in the last 7 days, but we are still looking at that rolling average over that 14-day period. We've consistently stayed below 1 in that 14-day average. So yes, we are seeing 5 hospitalizations, but this isn't anything that is out of the norm for Broomfield.
Yeah, I think it's just, it's amazing to see such a low number, considering a year ago from this point. So the second piece is regarding the vaccine approval. So we have seen the general vaccine approval for, please forgive me, I'm not using the correct terminology, so correct me if I'm wrong. The general vaccine approval, we've seen that for the older population, but for the younger population, we have not seen the general approval for those. That is still the emergency basis. Can you give us some more updates on where we are with those vaccine approvals and what we will be seeing in the near future?
Yeah, so I don't want to speculate too much. I've done that in the past on when we expect to see full authorization of the vaccines for the under 18 population. There is word that Pfizer is going to submit their recent data to recommend boosters for the 16 and 17-year-olds. We're also hearing their companies are ready to submit their data for the 2 to 5-year-olds population. No timeframes around both of those. And I would say the one thing that why the full authorization is important is Councilmember Cohen and Councilmember Marshall rightfully pointed out as these vaccines are very safe and effective. But once you get the full authorization, it allows you to look at, we do this for many other vaccines in schools. Should this be a required vaccine to go into school, similar to what we do for numerous vaccines?
Okay, well, thank you for that. And I guess, speculation aside, I guess we'll await to see what those next steps were. I was curious if you had any updates on that. In terms of vaccine clinics, Broomfield has held a number of these vaccine clinics, both for boosters as well as for the younger population. I believe that we have a vaccine clinic coming up this Saturday. Do we have any appointments available for this Saturday still, or did those all get booked up?
You want to take that?
Thanks for the question, Councilmember Schaaf. So for this Saturday, as you noted, the vaccine bus will be at the Alberta Rec Center. It'll be at the Broomfield Library on Thursday. The appointments are, for the most part, booked up for those events. They did fill quickly, and the guidance to the public is that if you would like to try walk-ups, certainly we'll try to accommodate those, but bring your patients because you will be intermingled with individuals that do have appointments. We are continuing through our team's efforts to have opportunities every week, multiple opportunities. And as Jason said earlier, there's, I think, just initial pressure on appointments because there is so much interest, which we're thrilled about. So we continue to create those opportunities. Just in the past 10 days, we've had 6 events and delivered almost 1,000 boosters through these mobile opportunities in and around Broomfield. That coupled with several hundred pediatric doses. So we'll continue to utilize that as an option, but certainly encourage individuals that if the mobile sites aren't a great option, go to our website, broomfield.org/COVID-vaccine, where you can quickly link to some of the healthcare providers and pharmacies that are also providing these appointments and make work better for your schedules if you're not able to come by on a standby basis.
Great. Well, thank you for that information regarding the vaccine clinics. I've heard a lot of positive comments that they're so thankful that Broomfield continues to do these clinics. It provides another opportunity. And a special shout out to the Thornton Fire Department. They have been receiving I have been receiving major kudos from them for their vaccine clinic. So please pass that on to them as well. Lastly is regarding the mask mandate. So a couple of their board members have expressed the idea that our mask mandate is different than surrounding communities. So one of the ideas that we were, the whole goal of putting the mask mandate is to ease the pressure on our hospital system. So can you talk a little bit about how wearing masks in the city, county, and Broomfield buildings is helping to lower transmissions and thus ease the pressure on those hospital systems?
Yeah, when we looked at it, we thought it was important for the city and county of Broomfield to lead by example. I mean, we have the health department in the city and county of Broomfield. And so we know the hospital system is stretched. We wanted to do our part to reduce transmission and reduce hopefully hospital capacity. And we've also reached out to the business community. We had a business town hall, and Jeff Mine has also been promoting to the business community toolkits on how they can follow our lead and do the same type of effort. And my understanding is the business community has been receptive to receiving those materials and looking at how they can potentially go about doing something similar.
Great, thank you so much. That's all I have, Chair.
Okay, thank you. Mayor Pro Tem and Board Members Zazorski.
Thank you, Madam Chair. Just anecdotally, I will say that I unfortunately have been out doing a lot of holiday shopping over the past week or so, both in Broomfield and outside of Broomfield. And as you mentioned, man, I haven't really seen much of a difference going into the stores, whether it was Target up in Westminster or Home Depot or Walmart here in Broomfield. So regardless of whether we're a little different or not, I think the ultimate what we're seeing is the same, at least pretty close to being the same. So having said that, I really do appreciate what I think is a careful, measured, and data-driven approach that we've taken here in Broomfield so far. And as was highlighted and continue to highlight, it's great that our hospitalizations are so low in Broomfield, and the numbers compared to last year look like it was like half compared to last year. So, we are highly vaccinated, and it seems to be working. So I think that's awesome. So keep up the good work on that. You've had a trying couple of years to stay at yeah. Anyways, one thing I would like to just think Councilmember or Board Member Chef pointing out the clinics that we do have here in Broomfield. I'm scheduled to go this Saturday. It did take me about a week in advance to get that appointment. So I think you mentioned that, and that seems to be the case right now. I looked at it last Saturday. I think the Thursday clinic was filled up at that point, but the Saturday one was open. So if you're looking right now, I should probably be able to get something for next Thursday or Saturday. If we're doing it regular, are we doing it regularly on those days, Thursdays and Saturdays? I'm assuming we are, but I don't know if that's the case.
Yeah, answer that.
It does vary week to week, just based on the ability. We're partnering with the state mobile vaccine bus to make those dates available. So we are definitely trying to balance both weekdays along with weekends so that people have options based on their schedule.
Great. And I will say that my wife went last Saturday. She said it went great, and she didn't think it would have been that bad either for walk-ups. She said it seemed as though the walk-up line was moving pretty quickly as well. So I think if anyone is in a hurry to get their booster shot or first or second shots, I would encourage you to just go on down and so maybe spend 10, 20 minutes, but it didn't seem like it was that bad when she was there. So that's all. Thank you.
Thanks, Mayor.
Thank you. Any other board member comments or questions? Seeing none, thank you both so much for your update and the entire public health team. We appreciate it.
I'll pass that along. Thank you.
Thank you. The second and final item for the Board of Health consideration this evening, as well as council's review, is proposed resolution number 2021-204-88, appointing Lindsay Lee and Mark Doherty to the Modified Regional Emergency Medical and Trauma Advisory Council. Items 9B and 11A are the same topic and will be reviewed concurrently this evening by the Board of Health and City Council. Council and board members have a copy of the agenda memorandum, which I'll ask our staff to summarize.
Director Balling, don't go anywhere. Next item is yours.
Yes, and we've brought this before the Board of Health and Council numerous times. We are one of several participating counties that participate in the Mile High RETAC. And the idea behind the RETAC is the coordination of emergency services in the Denver metro region. We've been very lucky to have membership, consistent membership on this committee. Dr. Maines was on it for numerous years, Captain Ross Riley, and I was on it, and thankfully Lindsay McGee, our emergency preparedness manager in public health, stepped up to take that role. We're before you today to seek your approval of our appointment to appoint Lindsay McGee and Chief Mark Doherty to replace Captain Ross Riley on the Mile High RETAC.
Welcome. Okay, well then, we will now proceed with public comment. Is there anyone who would like to be heard? Please press *3. And if you're here and would like to speak, come up to the podium. Not seeing any questions from the council and board or next. Are there any comments or questions? Right then. Next is council and the Board of Health. Consideration of proposed resolution number 2021-204-BH. Will the clerk please read proposed resolution number 2021-204-BH by title?
Resolution number 2021-204-BH, authorizing and approving the reappointment of Lindsay McGee and new appointment of Mark Doherty to Mile High Regional Emergency Medical and Trauma Advisory Council.
Thank you. Is there a motion? Council Board Member Shaw?
Thank you, Chair. I move that resolution number 2021-204-BH be adopted.
Thank you. Is there a second? Board Member Mark Olson?
Second.
Is there any discussion? So the clerk, was that discussion here? Okay. Board Member Shaw?
I just want to thank these individuals for stepping up, whether they're paid or whether not. But thank you for being willing to serve on this board. So just wanted to pass that on.
Councilmember Schaaf, I would promise to do this, but Lindsay McGee can stand up. Lindsay McGee is our emergency preparedness and response manager. She has been the one overseeing all of our testing events, coordinating all of those, coordinating our vaccine events, and then also on top of that, looking at monoclonal antibody therapy and reaching out to our providers. So we're very lucky to have Lindsay on our team.
We all love Lindsay.
Thank you for the introduction. Is there any other further discussion? All right, will the clerk please call the roll?
Jezierski?
Yes.
Leslie?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Marshall?
Yes.
Schaaf?
Yes.
Ward?
Yes.
Anderson?
Yes.
Cohen?
Yes.
Hinkle?
Yes. Thank you. That passes unanimously. Seeing there is no further business before the Board of Health, the meeting is adjourned. There is no business before the Bloomfield Housing Authority this evening. And we reviewed item 11A earlier in the agenda, so we will continue with item 11C. Next is the public hearing and council consideration of resolution number 2021-199, approving the use by special review for a wireless communications facility. I'll declare the public hearing open. We will follow the city's standard public hearing procedure. First, staff will present a summary of the proposal. Next, we'll have the applicant's presentation. Then we'll ask for public comments and final comments from the applicant. And then finally, questions from the city council and our board and authority members. Council has a copy of the agenda memorandum, which I'll ask our staff to cover.
Thank you, Mayor. Anna Burton-Zetti, Community Development Director, will introduce us to this item. The applicant is in the audience to field any additional calls, questions, comments. Thank you.
Thank you, and good evening, Mayor and City Council. If we could have the next slide, please. Nexius Solutions LLC, on behalf of AT&T, submitted this application. It's actually for 2 uses by special review. The first is for a wireless communication facility, and the second is for an increase in height from 25 feet to 55 feet to allow a full bell tower to house the wireless facility. In the R1 district, the maximum height is typically 30 feet, and an increase requires a use by special review. The property is about 3.5 acres and is developed with a church building, the parking, landscaping, and the exterior lighting. It's located at the northwest corner of Daphne and 10th. Next slide, please. The property is designated as public, quasi-public in the Broomfield Comprehensive Land Use Plan, and the long-range financial plan is based on this comprehensive plan. Land use designation is consistent with both, as it's currently developed as a religious facility. Next slide, please. In compliance with the Broomfield Municipal Code, the applicant conducted an evaluation of alternative locations. AT&T's radio frequency engineers determined that this was the preferred location to ensure network coverage for their customers. Before finalizing site locations, AT&T did approach the high school that's adjacent to the site to inquire about co-locating on some of their existing facilities, but the school district indicated that they were not interested in additional carriers on their property at this time. In compliance with the municipal code, the applicant has confirmed that the facility will comply at all times with the current FCC standards for cumulative field measurements of radio frequency power densities and electromagnetic fields, and that the antennas will operate at a frequency that is not to interfere with any public safety frequencies. And the applicant provided a vicinity map, which is on the screen, that depicts the existing and planned wireless communication facilities owned by AT&T within 5 miles of the proposed facility. Next slide, please. The use by special review is for the 55-foot tall faux bell tower. The footprint of this bell tower is about 16 feet by 16 feet. One existing evergreen tree will be moved and transplanted to accommodate the new tower. And the remaining 2 evergreens on this side of the church and the deciduous tree that's located on the east side of the building will help to screen and soften the appearance of this tower. The existing church building is about 30 feet in height, and the tower is proposed to be sited on the east side of the church. To camouflage the facility, the applicant is proposing a design that mimics the bell tower, where the antennas and electrical equipment and a backup generator will be fully enclosed. The generator is tested weekly and is inside a cabinet that provides sound attenuation. Next slide, please. This is just a color graphic rendering of the east side of the elevation of the church, and the lower drawing is of the elevation with the proposed bell tower, so you can see the difference. Above the base of the tower are 4 columns that support the belfry, and above that and within the upper part of the structure where the antennas would be located. Next slide. Land Use Review Commission held a public hearing on August 23rd of this year and reviewed the application and voted 7-0 in approval, recommending approval of these by special reviews without any conditions. But in response to some of Work's comments regarding details of the site design, the applicant did choose to relocate that tree that I mentioned rather than removing it, and added some insets along the top of the bell tower facade to help mimic the CME insets that are found in the church building. So those weren't conditions of work, but they still made the changes in response to the discussion. Noticing requirements were met for this hearing, and the applicant hosted the required neighborhood meeting, details of which are in the memorandum. Based on the review of the proposal, staff had identified 2 key issues that are detailed in the memorandum. The first is the increase in height from what is typically allowed within the R1 zoning district. And the second is the opposition to a wireless facility. There were residents that expressed concern regarding the proposed tower during the neighborhood meeting. also via Broomfield Voice and by email. Concerns included RFP emissions and impact to health, visual impacts, and the perceived incompatibility with residential uses. The applicant is required and has affirmed that the wireless facility will comply with FCC standards. And the applicant conducted a visual analysis, as was shown, to provide photo simulations to demonstrate how it will appear and complement the existing church. That concludes staff's presentation. And as mentioned, the applicant also has a presentation.
Wonderful. Thank you, Ms. Bertenzeri. Will the applicant's representative please come to the podium and identify themselves for the record prior to beginning their brief presentation this evening?
Good evening, everyone. My name is Jacqueline Levine, and I'm with Nexia Solutions. I'm just going to kind of do a little recap of what they went over here. Go to the next slide, please. So I'm going to just talk about the little site features here. So this is at the church there. It's a pretty large parcel adjacent to the high school. There are residential properties to the north and to the south. However, this is kind of situated more by the school. We did move it in order to mitigate visual impact. Next slide, please. This is just an overview of the area. Next slide. They have the same pictures as me. So this is we did add the inset. That was a request by the Land Use Commission, and we agreed that it does visually make it blend in better with the church. And all of the colors will be matching to the church as well. Next slide. Next slide as well, please. All right. And then as recommended, we also moved one of the trees as requested rather than removing it entirely. So that tree will be relocated. And I'm showing that there on that plan. Next slide, please. Again, so this is a photo simulation we had put together. This has since been updated since the Land Use Commission to show the inset and the details to match the church. Next slide, please. And then this is a coverage map just to kind of indicate what the need is here. So this is a capacity site. As you mentioned earlier this evening, the population growth in Broomfield is not going unknown. And people are complaining of lack of service in the area. So this site is meant to fill a gap for the capacity in the area. Again, we did reach out to the school, but they were not interested at the time. And additionally, it's a little bit better to have another location and some redundancy in the network. So this here, the dark green color shows the good indoor coverage. Light green is your good in vehicle, and blue is poor coverage. And you can see kind of in the middle there where our proposed site is. So this is what it currently shows. And the next slide. This is the proposed coverage with this tower. So it makes a huge, huge difference. In a time where a lot of people are working from home and a lot of people are using their cell phones, if your internet goes out, I know a lot of people hotspot, I do it all the time. And I think it's really important to make sure that people have the coverage they need, as well as with the high school being right there. I think it's really important to make sure that there is that ability to make calls as needed. And as many of you may know, the AT&T was awarded a contract from the government to do FirstNet build. So all towers that they build have FirstNet capabilities. That's my presentation.
Thank you very much. We will now proceed with public comment. Does any member of the public have any comments on this agenda item? Please step up to the podium, if so, and state your name and neighborhood for the record. And you have 3 minutes.
Good evening. My name is Bob Abeda. I actually was on the map a minute ago. My house is six houses down from the church. I came also to the Land Use Commission meeting as well to state my case, but this tower is very needed in our neighborhood. I'm an AT&T customer, and as was stated, when there is no wireless available, we are down to 1 bar, which it becomes, 1, a safety concern, because if the towers at the high school get knocked out for whatever reason, and there's no unreasonable things as we know in the last 2 years, then we need some redundancy built into the system, which would be very helpful. Also, the number of people that work from home, as that is, we have the presentation a minute ago, the Omicron variant's not going anywhere, so we really do need redundancy to be able to back up for folks that work from home, or if we go back to the schools, then indeed will probably happen someday where we have to do school from home, same sort of thing. So it is important that we have that sort of redundancy. As far as the safety concerns go, the American Cancer Society, as I had stated previously, the American Cancer Society has done a lot of research and a lot of work with all the commissions that would have oversight to this, and from their website, and I quote, radio frequency emissions from antennas used for cellular personal communication services transmissions result in exposure levels on the ground that are typically thousands of times below safety limits. These safety limits were adopted by the FCC based on the recommendations of expert organizations endorsed by agencies of the federal government responsible for health and safety. Therefore, there is no reason to believe that such towers could constitute a potential health hazard to nearby residents or students. So for the reasons of additional capacity, redundancy, safety, and the fact that it is very low emissions relative to any safety concerns, I ask the council to please adopt this and get us a new tower. Thank you.
Thank you very much. Any other public comment? I don't see any online. So, does the applicant have any final comment? We're not doing any board and commission progress. The questions from the city council or next. Members should limit themselves to questions during this portion. Time to introduce amendments and state positions for or against is later. Are there any questions? Councilmember Henkel.
Thank you, Mayor. And I didn't have any questions until you started talking about FirstNet capabilities. Can you explain what that is?
So AT&T was awarded a contract by the federal government to build FirstNet sites, and it's a dedicated network for the first responders. So it's its own frequency. Now it can be used as like a cell phone frequency, but it does have equipment. There's like more tailored equipment for first responders. So when you arrive at a scene, there can be more information. Also, they're on the same band, so it can have from county to county better communication, talking on the same frequencies.
Great, thank you very much.
Mayor Pro Tem Jaworski.
Thank you, Mayor. Well, I think there's no doubt that this is needed in our community. Like I say, one of the first things that I dealt with 6 years ago was a cell phone tower issue, and it was very controversial at the time. And thankfully, a lot of those concerns turned out to be, I guess, not as real as what the public feared. But I guess my main takeaway is that obviously the public understands now that this is something that we do need in our community. I know myself, I have a tough time getting cell coverage in a lot of different areas in Broomfield. So the one question I do have for staff though is, I know a few years ago, I've been to a presentation at a CML conference, and it was discussed at the time about implementing at some point like little micro towers. I don't know what you call them, go on streetlights and sort of help with that sort of last mile type of problem that we have. Is anything else going with that over the last few years?
We have. Thank you for the question, Mayor Pro Tem. So a few years ago, we took forward an initiative to council for what we call small cells, which are those co-locations of small cellular facilities that help to support the network. They're located primarily on street lights, sometimes on traffic lights, sometimes they're freestanding. And that's been very effective for us. I think we've probably processed, my best guess would be somewhere between 20 and 30 small cell facilities, primarily around the Arista area and around 287 or some that I remember recently, and I think a few on Sheridan as well. So council passed an ordinance that allowed those to be reviewed administratively as long as they met very strict requirements on their size and location and notification to adjacent property owners.
That's right. I do recall that now. That you mentioned it, and I'm glad to hear that we have some of those, and hoping that maybe we start to see more of those in the community, because it sounds like, I think they are kind of intrusive, and they I'm assuming will help solve this issue of coverage that we do see in this community. Thank you.
Thank you. We'll go to Councilmember Lim.
Thank you. I do want to pass along some of the questions from one or two Ward 3 residents, who are impacted by this. Could the staff or applicant clarify, are there any particular restrictions that are different on RF emissions based on proximity to, and this person was proposing daycare, or I guess it would be schools, to young elementary schools too, young children.
So for each site, this type of site, we actually have to do an EME report, which detects RF emissions, and that has to be submitted for review and approval. The factors change based on height. So the lower the tower is, there could be the potential for more of that. So another reason you want to make sure it's more off the ground for the incentive is for that reason. But generally, as was stated earlier, the emissions are regulated so strong, and they're typically they're a lot lower than what is actually allowed.
Okay, thank you for that. The other question has to do with the noise from the backup generator. So in the memo, it's described that testing of the backup generator would temporarily exceed the allowed noise limit. Obviously, it was my inclination to say, well, if you have a backup generator, you must have it for a purpose, so you must use it in some cases. I mean, so do you have an idea based on average, maximum? I mean, how frequently do you have to use the backup generator that it's going to end up where the noise level is exceeded in the neighborhood?
So it actually is not very common. We do have our own power. We get our own power source through the power provider through Excel. So the only time that we would be using a backup generator is in the event of a power outage. And a lot of people need their phones during power outage, so you don't want to lose that site. So we're just trying to ensure that even if there is a power outage or an emergency, that people do have their cell coverage.
Okay, and then a hypothetical, if you were to have to start to use it more frequently for some reason, do you have additional noise mitigations that you have used in other places that you would employ here if for some reason there were a number of noise complaints?
Yes, we could always do more dampening, but I believe because it's within this CMU block wall, that number that you're given is actually going to be much lower because it's going to be behind a brick wall, which is going to dampen the noise even further than what you've received.
Okay, thank you for those responses.
All right, thank you. Any other council member comments? Councilmember Schneider?
Thank you, Mayor. So I just have one question for the applicant. So you talked about the idea of working to co-locate this facility on the Broomfield High School property. With the construction of this bell tower, do you have the ability to co-locate another cell facility in this bell tower along with this one?
Absolutely. So another reason for the height is that it does allow for another carrier to co-locate below us. There is not additional ground space, so another carrier would need to get their own small ground space. However, every carrier has a different type of equipment. Some of them use very small cabinets, so it really varies. But they would be required to install their own ground equipment and get their own ground space, and that would be at the discretion of the church, obviously.
Okay, great, thank you. That's all I have, Mayor.
All right, thank you. Anyone else? Councilmember Anderson?
Thank you, and I appreciate the answers to the question about the health concerns of RF. So the only other question I have remaining is, will there actually be a bell in the bell tower, and are you open to that?
There wasn't a plan to put a bell. We can put a bell. The issue is, any kind of metallic objects in front of antennas create interference problems. So we could put something faux there per se, but it would not be functional.
Okay, I think that might be something to consider, so thank you.
Thank you. Anyone else? A faux bell, huh? Well, I'm just excited because we all work around here, and if you've ever driven Midway, don't bother taking a call or making a call because they won't hear you. So I'm excited. There being no further comments, the public hearing is closed. Next is council's consideration of proposed resolution number 2021-199. Will the clerk please read proposed resolution number 2021-199 by title?
Resolution number 2021-199, approving Broomfield United Methodist Church filing number 1, lot 1, used by special review for a wireless communications facility.
Thank you. Is there a motion? Councilman Leslie?
Move it.
You have to read the whole thing.
I'm sorry.
Mayor, if it's right after the clerk has read the motion, it would be acceptable to say so moved. They're close enough and just to save some
Thank
time.
you, because my computer screen kept jumping around. So move the resolution, Mayor.
Thank you very much. Is there a second? Yeah, Councilmember Ward.
Seconded.
Thank you. Is there any discussion? All right, will the clerk please call the roll?
Leslie,
Yes.
Lamb,
Yes.
Winstead,
Yes.
Marsh Holston,
Yes.
Schaff,
Yes.
Ward,
Yes.
Anderson,
Yes.
Cohen,
Yes.
Hinkle,
Move it, yes.
Jazersky.
Yes.
That passes unanimously. Thank you all very much. Well, since it's 7:58, we'll go ahead and take our 10-minute recess now before we get into the big thing. So we'll reconvene at 8:08. 10 minutes. Thank you.
The Access Live event is in music hold. music hold ended.
Dismissing Councilmember Anderson, I shall call her out. There she is, Councilmember Anderson, and Ms. Brown. All right, welcome back, everyone. Next is the public hearing and council consideration of the two proposed resolutions and two ordinances on second and final reading related to the 12,000 Wadsworth subdivision. I'll now declare the public hearing open. We will follow the city's standard public hearing procedures as previously outlined. Council has a copy of the agenda memorandum, which I'll ask our staff to summarize.
Thank you again, Mayor. And we were teasing up here. We got such a kick out of the move it. We're happy that we weren't televised, Dr. Leslie, or we would have been giggling harder. Ms. Bertanzetti is going to walk us through this item. Applicants are here for additional questions, and away we go. Ms. Bertanzetti.
Thank you. Good evening again, Mayor, City Council, Anna Bertanzetti, Planning Director. Arlington Properties has submitted an application, if we could have the next slide, for rezoning a right-of-way vacation PUD plan, final plat, and a site development plan for a piece of property that's just over 13 acres for a residential project. The proposal will rezone and replat 4 existing B2 zone pieces of property into one PUD plan, PUD zone property, to allow for residential use with a private tract for drainage and detention. The parcels are additionally located within the interchange influence area, which allows multifamily residential uses as a permitted use as well under that IIA. The applicant site development plan is for their proposed multifamily residential development that consists of 300 apartments distributed among 6 5-story buildings. The applicant site plan also includes private amenities, trail access, and on-site parking for the community's future residents. Next slide, please. The Burnfield Comprehensive Plan designation for the subject property is mixed-use commercial. As a guideline, no more than 30% of the land use within this district is intended to be used for residential uses unless approved through a PUD process. If the property is rezoned to PUD and a PUD plan is approved allowing residential uses, then this use would be consistent with the mixed-use commercial land use designations, since we would also include this parcel with adjacent properties to the west that are also designated mixed-use commercial. So that area includes the Interlochen Business Park. The overall area includes a mix of office, employment, and residential uses consistent with this designation. The proposal is not, however, consistent with the land use assumptions in the Brookfield Long Range Financial Plan, since the land had been assumed to be developed in the future for non-residential uses consistent with the B2 zoning. The proposal reduces the expenditures to revenues in the Long Range Financial Plan from 1.344 to 1.333 and reduces projected annual revenue at build out by about $304,561. Next slide, please. The original plat for the 12,000 Wadsworth subdivision had dedicated public right-of-way extending from Interlochen Loop to the south of the project to the center of the site. This dedication was intended to provide future access to the commercial properties and was named Thomas Court. Thomas Court was never constructed and the properties were never developed for commercial uses. The applicant is requesting this evening for the right-of-way for Thomas Court to be vacated. Next slide, please. The development proposal includes 300 apartment units and 6 buildings. The main access point to the site will be a right-in, right-out from the south of the parcel along Interlochen Loop, and a secondary access point is provided to the northwest of the site. There will be a total of 6 residential buildings, with 1 building oriented along Interlochen Loop and 5 remaining generally located towards the center of the parcel. There's also a 2-story clubhouse. There are multiple amenities in the community, including a pool area, a dog park, and several grilling and seating areas. The site will include pedestrian and bicycle access to adjacent trail corridors. The proposal has identified 2 potential public art locations. These art installations are being finalized through the construction document process. The proposal includes 3 variances. These are a setback variance, so the interchange influence area establishes a 30-foot setback requirement for buildings and parkings. The applicant is requesting a reduction to this setback to be 12 feet for parking to meet some site constraints. The landscaping has been provided to screen this parking area, and the building setbacks will remain compliant with the 30-foot setback. The second is for a fence material variance. The interchange influence area also establishes that all fencing is intended to be constructed of brick, masonry, or stone. The applicant is asking to be able to use fencing materials that's more consistent with a residential use, such as wood, steel, and aluminum. Like I said, those are all consistent with what we typically see in residential development. The third variance is to allow a preliminary plat to not be included in the PUD plan. And this is because the applicant has already submitted their final plat. So the material or the information which would have been in the preliminary plat is provided in the final plat. Next slide, please. The proposed architecture on the site features a modern style, and materials are consistent with Camden Flatiron Apartments, which are to the east. Are to the west of this proposal. The darker neutral color scheme is used throughout all of 6 buildings, and the building facades feature pop-outs and roof overhangs to provide visual interest. There are also balconies provided to allow outdoor space. Next slide, please. Affordable housing requirements are being met through the inclusion of affordable housing within this development. There are 60 units that will be provided at 60% of area median income, and this would be for a term of 40 years. There is a memorandum of understanding included with your memorandum, which specifies this agreement, as well as the obligations for the fee waivers, which are consistent with the code. Next slide, please. The Land Use Review Commission reviewed and recommended approval of the proposal without any conditions. Then residents did attend a neighborhood meeting. I'm sorry, just one resident attended a neighborhood meeting that was hosted by the applicant, and public hearing requirements have been met. The only key issue identified by staff was that negative impact on the One Ridge financial plan, which I previously discussed and is more detailed in the memorandum. And that concludes our staff presentation. The applicant is also here this evening.
Thank you, Ms. Bertanzetti. Next is the applicant presentation. Will the applicant's representative please identify themselves for the record prior to beginning their brief presentation?
Michelle, thank you. Good evening, Mayor Pro Tem, and council members. My name is Chris Grady. I'm with Kemp Art Community Planning Architecture, 2555 Walnut Street, Denver. With our group here, I've got Mark Stourman from Arlington Properties, the applicant, and also Connor Culligan, our civil engineer with HKS. Just want to take a couple minutes to review a site analysis and how it informed our site plan, and then look at some regional vicinity. And this is really more clarifying information that we did not have available at the Land Use Commission meeting that we had a while back. First off, I'd like to take a quick sidebar. I want to speak about a valued team member that is no longer with us. Many of you knew Susan Stanton, and her company is Stanton Solutions, and I'm pretty sure a lot of you folks knew her quite well. She had a passion for our building industry. She was a great strategist and quite knowledgeable, and she built many relationships, a lot of those here in Broomfield. And she was an amazing colleague and friend. We've missed her since her passing in August of 2020. And I was a month or two prior to her passing, she began working with our team on this Bellow Interlocking project. And she would love to be here today and see our progress and see this project come to fruition. So we all miss her very much. Thanks for pulling up this next image. The site analysis, I'm just going to go through three quick images. Again, this is 13.4 acres. North is up on the page. And the high point is along State Highway 128. There's two entry points on the project. The first one is a right in, right out on State Highway 128, which is interlocking loop. And the second is on the northwest corner at Edgeview Drive. And that allows access to Edgeview Lane, or I'm sorry, Edgeview Drive and Highway 128 through Interlocking Boulevard. The key challenge on this site is the 80-foot grade drop from south to north. And this informed our approach to the site design. And you can see from the yellow arrows, this site has excellent views to the north, west, and east. There's an existing public service easement on the northeast corner of the site. And that green circle is a low point, which is ideal for detention. But it was very important for us to create a plan that fits the land. And so the site analysis is a very important communication tool. Next slide, please. Let's go to the next. After this. I'm going to go back to the other one in a minute. We spent a lot of time here on the site plan. We've developed a product in a neighborhood design which responds to the landform. So we created an uphill and downhill product. And that product, in all of these buildings, takes up 11 feet of grade. And so we developed an uphill and downhill split. The downhill split is a 48 unit building. And where the entry and the garage are up on the high side. And then a 52 unit downhill building, a 5-4 split. And then the entry and the garage on the downhill side. And again, circulation with this 80 feet of grade, circulation and parking, we had to create a number of neighborhoods or pods that had to work down through this site from south to north, down to that second entry on the northwest corner. So it's a combination of uphill and downhill product and also additional retaining walls on the site. The way the site lays in it provided a fantastic opportunity to get a focal point as a clubhouse at the entry. And that clubhouse is 2 levels, 1 level on the upper side, 2 levels on the lower side, which also has great views. And this, again, it becomes that wow factor as you drive into the community. The parking meets code. There's attached garage parking to each building, tandem parking, carports, and open parking. Trail connections are also indicated to the US 36 bikeway and the Brookfield Trail, which is on the north and the south. And we're also working with the Public Art Committee for 2 locations for placement of impactful installations. We also have EV charging stations, short-term bike parking and storage, and adequate snow storage. So again, it was just important to better identify and show you the process by which we developed a product that fit the land, have a product that really fits into the landform, and have it be a very attractive architectural feature in the community. Let's go back to that previous slide. The last image is a context plan. It's a regional vicinity map. This will also be helpful to kind of give you that overall picture. It's a 5,000-foot view, if you will, which shows adjacencies and circulation, the external circulation of the project for reference. So it clearly shows the property connections to the existing 12-foot US 36 bikeway on the north, and then the Broomfield Trail 8-foot connection on the south. Again, the circulation, it's really important to show how that moves through the site, and that we've got that entry along the interlocking loop or Highway 128 that is a right in right out only. And then on the northwest corner of the project, that takes us to Edgeview Drive, Interlochen Boulevard, and the signal at Highway 128 and Interlochen Boulevard. So with that, I will turn it over to Mark Starman from Arlington for some additional comments and some wrap up. He'll wrap up the presentation. Thank you.
Okay, good evening. I'll be quick. I want to thank you all for your time, and I want to thank my team and Broomfield staff. Helping great. Y'all really helped us shepherd this thing through, and we really appreciate it. What I'd like for you all to hear is that we, as a company and personally, believe in creating great communities for people, especially after 2020, residents, well, really homeowners, people are working and spending much more time to their homes. So it's critical in our view that it creates small spaces inside and outside for people to gather, and have interaction when it's safe, but also to have a place where they can work and feel comfortable at home. We're also equally passionate about providing attainable housing and are optimistic that we can partner with the city and county of Broomfield and do that here. And that's something we as a company have done since the 80s. But I think staff and Chris have done a very thorough job describing the property, and I'd love to answer any more questions about the affordable housing component, the commercial complexities, and why this site physically is not quite a fit. But again, just appreciate your time and look forward to the potential of creating a great place to live, work, and play in Broomfield. Thank you.
Thank you very much. Does that conclude the presentation? All right, we'll now proceed with public comment. Does any member of the public have any comments on this agenda item? Doesn't seem like it. Then we'll move on to questions from City Council. Members should limit their questions during this portion, the time to introduce amendments and state positions for or against his solution. Are there any questions, Councilmember Shaw?
Thank you, Mayor. So this is a question for staff. So we've come across this before and fairly recently of difficult developed properties, and we see this conversion going from commercial to residential, which impacts our long-range financial plan. How many more of these difficult to develop properties do we have coming up in the pipeline?
So we have seen a number of these through concept review in the last 12 to 24 months, I think we're going to see continued requests. They may not make it all the way to council, but we'll still see inquiries for smaller properties. There aren't as many larger properties except for like the Highlands PUD area north of Colorado 7. There have been 2 concept reviews, both of which would request a change to allow residential. East of I-25, that's an area where the community will need to focus in the future, since there's lots of property east of I-25. We had not necessarily anticipated a lot of residential in that area. And as that area is more focused in planning, as we provide utilities there, that'll be an area that we need to focus on. But in terms of larger undeveloped properties in this area, I think we'll see more focused requests, more like Avenue 120, where it's a component asking to extend existing residential, potentially adding more mixed use throughout like the 120th Avenue corridor. But in terms of larger undeveloped properties, I can't think of very many, just because a lot of our undeveloped properties, especially in this area, are impacted by the critical zone for the airport, or are in Interlochen, where we've heard very loud and clear from council that that's a very big area of concern to see much more proposals in that particular business park converting to residential.
Okay, great. Well, I appreciate that information. It helps me to distill kind of the project that we have in front of us today. And hopefully, as we start to move through, some of our comprehensive planning stages and other plan updates, that we'll start to look at that, because the impact to our long-range financial plan does continue to take a hit. And so if we can get out in front of this anymore with some of those plans, it would be great. In the memo, there is an impact to the CDOT plans, or at least the conceptual plans that they had at that point. At this point, it seems like CDOT is kind of washing their hands of whatever they're going to be dealing with. How does this impact those future CDOT plans, though, with regard to this area?
Thank you for your question, Councilmember Shack. So we did refer the plans and have specific discussions with CDOT regarding that. CDOT is not ready to acquire property and didn't object to the proposal moving forward. But you're correct, with this development moves forward, the CDOT would need to reevaluate their final designs. Whenever that were to occur in the future, they take that into account as they work through final designs for expansion.
And I don't know if this can even be done, but has staff looked at the impact without those plans being done, what that's going to look like for our traffic in this area?
It'd be too early for us to look at that and the impact of it, but it would be understood that there would likely be an impact to the final design. They need to evaluate that in the future. And we work with CDOT on that.
Thank you. That's all I have, Mayor.
All right, any other council member comments? Councilmember Leslie?
This is for the applicant. You're looking for a variance on fencing, I understand. Could you explain where the fencing is and what kind of fencing you're looking at?
There is fencing around the pool specifically to, just for life safety reasons. And that's just intended to be more, it really through the architecture to be more residential in nature. But that's really it, correct?
So it's really internal to the development,
it's
it's not external or good.
That's correct.
Thank you.
That's it? All right. Councilmember Kelly?
Thank you. Quick question. Since you're utilizing 100% cash in lieu for open space, which I don't love, but particularly because it's surrounded by busy highways, it looks like there is a park maybe within 10 minutes walking distance down the trail. And this may be a question more for staff. It said the Parks Committee reviewed this, but I don't see the Open Space Committee reviewed it.
I'm looking at Shelby. I assume this went to Open Space and Trails, the department to be referred over. So this would have been reviewed by the subcommittee, more than likely at the open space, rather than going to a full meeting, since it was a cash and lieu proposal. So they're not looking at a specific open space proposal for improvement. But it went to vote in their effective group, because they each operate a little bit differently. Open Space and Trails has now a subcommittee of appointees who look at the development proposals.
Okay, that just a question, because it wasn't mentioned in the memo that they had reviewed it at all.
That was likely our oversight rather than a lack of process.
I guess my only concern is that doesn't appear to be much in the way of open space anywhere within walking distance, except maybe down that trail. I'm not sure how far I forget the name of the park. That would be my one concern about it. Thank you.
Susie, anybody want to address the park? Oh, go ahead. Where's the park?
We do have one small dog park, but in order to provide the affordability, we needed to maximize the size, so that's why we did cash and lieu.
Sorry, Mayor, I missed the question, but East Park is, yes, located to the west of this site in the Interlochen development.
Thank you, Ms. Benson. Councilmember Anderson?
Thank you. I have a question about the deed restricted units. I'm not sure if this is for staff or if the applicant can answer, but I'm just curious. It's for a minimum of 40 years, and I'm just curious how that works when we're a long ways away from there, but when a 40-year time frame comes, and somebody is renting that unit, would it stay for the duration of their time there? Is that, or would that and maybe?
That's probably something we would have to coordinate with fair housing, but I don't.
I think one of our staff members, Jeff Remine, may have an answer to that.
Mayor, Council, Mayor Pro Tem, and Council members, Jeff Romine, Director of Economic Vitality. So your question is related to the affordability period, as you noted from the packet that it's a 40-year affordability period. The individuals would be income qualified. They would then move in. That'd be done by the developer or the owner of the property. As they mature, their incomes may rise and they may be adjusted, but they're income qualified each year. And then those units would then float within the development itself. They would then continue throughout the period of time. So as an example, someone comes in, they're income qualified, they take the unit, we'll say it's 60% AMI, then their income rises up, there would be a requirement for those additional opportunities for another person.
Okay, I think my question is more along the lines of if you were the one renting at 40 years at that mark and you were in that unit, would it just sort of end at 40 years or would you continue to?
So generally speaking, so these are set up in that sense of the 40-year requirement. Yes, so the affordability period would end at that point, but generally as they move forward, oftentimes there's a relook that sometimes happens with these types of developments, and then there's an opportunity for reinvestment. The reason why it's set up in that manner is oftentimes the developer will have to make a major reinvestment, whether it be into some of the capital stock within the site. And so we could potentially negotiate for an additional period of time with an additional subsidy at that point, if that's something that they wanted to do and we wanted to do at this time.
Okay, thank you. That's helpful. And then I have a question about sustainability. This is for the applicant. If there's any opportunity for solar, is that something that was looked into?
That is something that we have looked at as a design team, and we really didn't find a great solution for it. So that's something we continue to explore, but it's not a great answer, but that's kind of where we landed between the architect, engineer, and electrical engineers.
Okay, Jim, and this is like curiosity as we move forward with future developments. Is there like a reason that it wasn't a good fit? Is it just difficult to put the solar onto
the response I got is that none of our consultants understood how to design it to tie it back into the system.
Okay, thank you. All right, and that's all the questions I have. Thank you.
All right, Councilmember Ward.
Thank you, Mayor. My question is in regards to accessibility to the US 36 bike trail. I understand you do have one of the previous slides, there was a new connection you're going to do more on the eastern side of the property. Have you looked at any other connections, especially since the new hotel that has gone up by a on the north side of the Camden Flatirons, they have created a brand new on a multi-use path that is pretty much butt up against where your proposed northwest entrance would be.
So our connection to Grandview contemplates, after getting a little bit more easement space, contemplates 2 lanes of traffic and a sidewalk. So yes, it is our intent to have a connection on the east as we previously on the plans, and then on our secondary entrance, there'll be a trail to connect to what the hotel's done.
Perfect. And then my next question is going to be probably more towards staff. Since if this property does move forward, we'll be taking a financial hit in the long range plan. How many more properties in the interlocking area have been undeveloped and are zoned for either commercial or multi-use use?
And Councilmember Cohen, I don't think I'm sorry, Board, I don't have that, information handy tonight. We did put that information together though when the last interlocking, piece within interlocking was converted from business to commercial, so we could provide that to council, or I could look it up right now, but I have to look it up because we have a number of pieces of property that are undeveloped.
Okay. The other reason I asked that question is as we continue to move forward and with our housing needs that Broomfield is experiencing, as well as the changes the pandemic has caused to in-person office use, I question how much more office space we will actually need in the interlocking tech area that will be used on those pads versus converting them to more of a residential mixed-use development. I don't know if our economic vitality person has anything to say on that.
Okay. The city manager looked like she was ready to pounce, and so I can allow her to pounce.
I was gonna say quickly, so the theme here, we got an email from Councilmember Cohen. So I think the theme is a more strategic approach as we move forward. And so when we as staff get questions about what's happening next and where, and we need to circle back, and again, I think when we talk about budget, when we talk about the next 2, 5, 7, 10 years, and having that eye for the visionary and the future, actually, David Allen and I were talking about this just today. So the comprehensive plan was done in 2016. What we looked like in 2016 from a development or a land area perspective is vastly different than where we are now. And so, and we didn't have sustainability. We didn't have the impetus for affordable housing. So all of these, again, now that we actually have some, I don't want to say breathing room, but the opportunity to shift into what recovery looks like, a lot of that strategy hasn't been done. And we haven't had the opportunity to really look at from the long-range financial plan to comp plan, implementing the development matrix, if not here, where? And to Councilmember Cohen's question and Councilmember Schaaf just earlier, every time we have one of these compounding effects, incrementally, it doesn't seem like it's significant. But when you do take into account being able to be mobile and adapt and have a model that then Jeff can input from the impact perspective. And so it's not a decision on should we impact it or should we not, right? And it's not really a discussion on the straight conversion from residential to, or from commercial to residential. On the surface, it looks like we are, and I'm not going to say any neighbors' names, but what we don't want to have happen is turning into a full residential community where we're not mindful of what that balance looks like. So as we move forward, particularly with the infill, so this particular development, this is a hard spot to develop. So when we look at all of those other caveats, that in a less difficult spot, we would have the public land dedications, and all those other accoutrements. But when we're looking at, we have 25% left to develop. We can't move forward 2022, 2023, 2024 unless we have a very strategic approach about what goes where. So we're entering into that phase now. It's a little more complicated than just looking at those data-driven decisions. I had a meeting today, Councilmember Ward, in Arista about an office building. So again, from the developer's perspective, they won't build what they can't fill, right? And so paying attention to what we have now, what we want to have in the future, that's why the two big announcements were so key for us, right? Keeping Crocs here and Quantum. And so it's not just a big deal because of the footprint, right? It's a bigger deal because of comprehensively what we're able to do with that. So we are committed to making sure that council doesn't have to ask those questions about what the strategy is as we move forward. And we're not there yet. So Jeff, and you and I spoke earlier, not earlier today, on this particular issue, but from Councilmember Cohen's request on what that form looks like rather than having piecemeal. Will you talk just a little bit about that?
Sure, and Mayor Pro Tem and council members, just to build, first place is Anna is always fast. So there's 101 acres of land still available that's undeveloped within Interlochen. We are working with actually some developers on office buildings for those. Based upon council and city manager's direction, we are strongly indicating that we are not favorably inclined to develop those as residential. However, I'm going to pause there for a second and then begin to move into what City County Manager Hoffman asked me to respond to also. And that is the way that the long-range financial plan was developed initially, it oftentimes had a single use almost activity within the properties. What we're seeing a significant amount of activity now coming forward is obviously a multi-use activity within properties. And so thinking through that and also thinking about it as we rise up in the heights as opposed to single floor densities. And so that's the evolution that we see within the long range financial plan, as well as protecting those opportunities. We were very careful. If you refer back to the concept review on this particular property, we thought very hard about whether this could develop as a commercial property, recognizing the slope, grade issues that is already mentioned, as well as the access into the property. We felt that this was a reasonable alternative. However, we are being very strict and very strong in that and resolute in those responses to that remaining 101 acres. Finally, to City and County Manager Hoffman's comment, and this is response to Councilmember Cohen's question earlier today. Brenda Ritchie and I, the CFO, and Jennifer had a quick exchange, and so we'll be working through to provide that additional information for council to talk about giving some additional clarity, so it's not just the single number that you're seeing in this particular memo, it's $304,000, but talking about it in the whole and talking about how that cumulative effect begins to occur, and also how that modifies and changes the way the long-range financial plan. County Manager Hoffman did respond also and talked a little bit about the relationship between the long-range financial plan as well as the comprehensive plan, which was passed in 2006. So we're looking at how that fits together as a whole in this coming year to be able to provide both short-term answers to those questions as well as the longer-term, more strategic answer as you've asked, Councilmember Ward. Thank you.
Thank you. And my last question is going to be in regards to sustainability as well at the property. I know Councilmember Anderson asked about solar. I'm going to go with sustainability in terms of waste diversion from trash and what kind of recycling will you be providing and how often will that be collected? Because I live in the Interlochen area, and some of the apartment complexes I've lived at have not collected recycling on a regular basis to prevent overflowing, et cetera.
So we are a developer builder manager. It is our intention to collect recycling. That will be finalized as we move into the management portion. But we are doing best in practice in terms of water, low flow fixtures. We've entered into Excel's program to make sure that we're sustainable as possibly can be with all the power usages, and we have EV charging stations. So those are kind of the areas in which we focused on sustainability.
Okay, and then any talks about potential for composting? I know that's probably not something that's usually done at an apartment complex, but I'm just gonna throw that out there anyways.
We've not contemplated that.
Okay, that's it. Thank you, Mayor.
Mayor, I just quickly, a lot of our department heads that are, that they watch, heaven forbid, every single council meeting. But that allows us to have some pretty immediate questions. Abby, were you able to talk to Kristen?
Yeah, so Kristen, our Director of Open Space and Trails, she said that the OSAC subcommittee did review this, and the site was not well suited for open space. Didn't really want to mess with the drainage area as far as options, so they focused on the trail connections. Is what Kristen said, and she's listening if there's any further questions.
That's fantastic. Real time. All right.
There you go.
Councilmember Leslie.
I have a follow-up question to Councilmember Anderson's issue about the 40-year point, because I would think this would be relevant to any other similar project. But is there any way you confirm that if a person is in that situation where they are eligible for it and are in an apartment? And thank you, by the way, for including that in your project. I really appreciate that. Also appreciate the suggestion of some public art, because that could also serve as kind of a little mini park if it's done in a way that people could use it rather than just stare at it. But is there some way that somebody can affirm that the person is not going to be evicted at the 40-year mark just because they've reached that point? I assume that they'll probably be given notice and stuff like that, but it would seem to me that those people 40 years from now who are in that situation shouldn't be in that situation, and that we can perhaps have some effect of preventing them from being evicted at that point.
Well, it is, so we comply with the promulgated rates from the state for 60% AMI, and that's a burden that we have to comply with the state. So I don't know, it's a good question, it's one I don't have an answer to, but.
I'm gonna help you out.
Thank you.
And ask you that Jeff Romine to come up and, only because we've talked about this, Councilmember Leslie.
So, Mayor Pro Tem, so once again, this is a Boulder requirement, or, I'm sorry, I don't know why I said that, a Broomfield requirement. Different issue, different thing, sorry. It's been a long day. So I apologize.
Don't blame me for putting you in that position, please.
But it's a Broomfield requirement, it's not a state requirement for these particular units. Oftentimes with landlords, they will provide some sort of leverage at the same time, or some sort of options. At the same time, we, as well as hopefully our newly constituted Broomfield Housing Authority, will be in a place where we'll reach out to those residents and identify other alternatives within the community. A 40-year requirement is a very long requirement for a property owner to bring forward. I do know some that are 99 years, and I know some that are as short as 10 or 20 years. So this is a fair amount of time. And once again, I just reference back to the fact that oftentimes at that point, there's a reinvestment that would be occurring. This is far beyond oftentimes most of their financing. So we'll have the opportunity to kind of be in it. So we will be in a consistent conversation with them for all 40 years related to these types of programs. And then we'll be able to, as a program staff, as you can tell, I'm getting older. Clearly that I can't remember what stand in sometimes. So I probably won't be here, but my successors will be to make sure that there is that continuity. Thank you, Councilmember Mayor.
Thank you.
Thank you, Mr. Romine. Any other council member comments? We're still on comments. I mean, questions, yeah, sure. I know your question, your comment. All right, we're moving on. I see I'm losing it too. All right, then there being no further comments, the public hearing is closed. Next is council's consideration of proposed ordinance number 2167 on second and final reading. Will the clerk please read proposed ordinance number 2167 by title?
Ordinance number 2167, rezoning certain land located at 12,000 Thomas Court, 12,015 Thomas Court, 12,020 Thomas Court, and 2680 West 120th Avenue, north of Interlochen Loop within the city and county of Broomfield from general business B-2 to planned unit development, second and final reading.
Is there a motion?
I'll move the resolution.
Councilmember Leslie, thank you. Is there a second? Councilmember Lindstedt? All right, is there any discussion? Councilmember Lindstedt?
Right time. I just wanted to real quickly thank you guys for all the work. I was really hard on a developer a couple weeks ago for saying that they had a really hard to develop lot. But you guys, in fact, have a very, very hard to develop lot. So I just wanted to give you a shout out for the workforce housing and all the work. I know we've been talking about this development basically since I got on council. So I think it's a good solution for this very, very difficult and steep parcel. So I just wanted to say that and make sure you know how much we appreciate you guys coming forward with the solution. So I'm excited about it, and good luck. And yeah, it's a really, really hard lot in our county to develop. So I'm happy to see it move forward. Thanks.
Thank you. Councilmember Shah?
Thank you, Mayor. So I agree with Councilmember Lindstedt on this. It is a difficult property, and we definitely, we're hoping for some mixed use on this property when we saw it in concept review, or at least I was hoping that, that there would be some, greater concern taken that we were going to be shifting this from commercial to residential, but there are limitations with this property. So you all have done a tremendous opportunity to include the inclusionary housing ordinance that is there, and that was one of my big asks that was going to be important as we came to this conversation tonight. I would also encourage you to do both of those public art installations if possible. I do think that both of them do add a lot of value. Both of them are different, and I think they would be great pieces of the property. And I think that as this continues to move forward, looking at the robust bike infrastructure, this is a prime spot for that US 36 bikeway. There's going to be more and more EVs. Those EVs are a much more expensive bike. They take up more room. And so having a more robust bike infrastructure on this property, whether that's going to be now or in the future, is going to be greatly needed. So hopefully you'll continue to keep your eye on that. So appreciate you bringing this project forward and looking forward to supporting it tonight.
Thank you. Councilmember Henkel?
Thank you, Mayor. I concur with the two gentlemen that were before me. And I also want to just, reiterate too, that even though this changes the long-range financial plan, I even think our long-range financial plan could stand to be challenged a little bit in the fact that we cannot have commercial if we don't have the people there to buy those things. So I would like to remind everyone that that's something that we should look forward to in the future when we just sort of evaluate what our long-range financial plan does and how it's calculated. Thank you.
Thank you. Councilmember Ward?
Yes, I just want to reiterate everything that's been said previously by my fellow council members. I really appreciate you incorporating the EV infrastructure, especially far more than some of the developments we've seen come across our plate. The bike infrastructure, especially, and including those affordable units to greatly help our community. Thank you.
Thank you. Councilmember Cohen?
Sorry. Yes. Let me call Kristen and come over and help. I do want to. She'll be here at 5. Don't worry. I do want to thank the amazing Kristen for keeping her pulse. Touch the pulse of what am I trying to say? Keeping in touch. And keeping what's going on with open space and answering that question for me. I do appreciate all the affordable housing in particular and the work you have done done on this site. I just want to say, I think with the cash in lieu payment, it's incumbent upon us to make sure that we use those funds in some way to create useful open space near this development. There's a lot of people living there in between busy highways and not a lot of access other than that one trail. And I don't want to set a precedent that affordable means less open space. Folks who live in apartments need open space more than anyone else. So, but thank you again for the development and, as Councilmember Lindstedt said, making the effort to make this property work.
Thank you. Any other council member comments? Well, I agree with all of it. It's going to be beautiful, and I really do like the proposed hills and waves and the art. It's very peaceful. We need more of that. So, with that, will the clerk please call the roll?
Lim,
Yes.
Lindstedt,
Yes.
Marsh Holston,
Yes.
Schaff,
Yes.
Ward,
Yes.
Anderson. Yeah. Cohen,
Yes.
Hinkle,
Yes.
Jezerski.
Yes.
Leslie.
Yes.
That passes unanimously. Next is council's consideration of proposed ordinance number 2168 on second and final reading. Will the clerk please read proposed ordinance number 2168 by title?
Ordinance number 2168 vacating a 39.5 foot public right of way within the 12,000 Wadsworth subdivision, second and final reading.
Thank you. Is there a motion? Councilmember Ward?
I'm so.
That works for me. Is there a second? Councilmember Schaaf?
Second.
Is there any discussion? We already covered that. Awesome. Will the clerk please call the roll?
Lindstedt,
Yes.
Marsh Holston,
Yes.
Schaff,
Yes.
Ward,
Yes.
Anderson.
Yes.
Cohen,
Yes.
Hinkle,
Kristen, are you listening? Yes.
Jezerski.
Yes.
Leslie.
Yes.
Lim.
Yes.
That passes unanimously. Next is council's consideration of proposed resolution number 2021-183. Will the clerk please read proposed resolution number 2021-183 by title?
Resolution number 2021-183, authorizing and approving the 12,000 Wadsworth filing number 1, lot 1, and the 12,000 Wadsworth filing number 1, tract A, planned unit development, plan amendment, final plat, site development plan.
Is there a motion? Councilmember Marsh Holston?
So moved.
Thank you. Is there a second?
Second.
Councilmember Leslie, thank you. Is there any discussion? Will the clerk please call the roll?
Marsh Holston,
Yes.
Schaff,
Yes.
Ward,
Yes.
Anderson,
Yes.
Cohen,
Yes.
Hinkle,
Yes.
Jezerski.
Yes.
Leslie.
Yes.
Lim.
Yes.
Lindstedt.
Yes.
That passes unanimously. Next is council's consideration of proposed resolution number 2021-205. Will the clerk please read proposed resolution number 2021-205 by title?
Resolution number 2021-205, authorizing and approving a memorandum of understanding for an affordable rental housing program related to the low interlocking residential project.
Kristen has raised her hand.
Oh, Kristen, where? Oh, Kristen Prince, you have the floor.
No need to say anything. Thank you. I'm sorry.
All right. Well, thank you. Did we get a second? Did we get a motion? Oh, can we have a motion?
I'll move it.
Who said that?
Mayor, I did. I'll move it. I have to move it. I have to fulfill my potential tonight.
Definitely, yes, we agree. And Councilmember Schaaf, second?
Second.
Is there any discussion? All right, will the clerk please call the roll?
Schaaf,
Yes.
Ward,
Yes.
Anderson,
Yes.
Cohen,
Yes.
Hinkle,
Yes.
Jezerski.
Yes.
Leslie.
Yes.
Lim.
Yes.
Lindstedt.
Yes.
Marsh Holston.
Yes.
Thank you. That passes unanimously. Thank you all very much. Congratulations. All right.
Mayor, can I just, it's Bruce here. I want to compliment them for mentioning their colleague who has since passed. I just thought that was great and generous of you guys, so thank you for doing that.
We appreciate you. All right, the city and county attorney's report is next. Ms. Rogers, do you have a report?
No, not this evening. Thank you.
Thank you. The city and county manager's report is next. Ms. Hoffman, do you have a report?
I do, just briefly reminding council that tomorrow, excuse me, we are moving into the final phases for our police chief. So they have a very long day tomorrow. They are with a panel of department heads and deputies in the morning. Then we go to the police department employee forum tomorrow afternoon. They get a good night rest. And then tomorrow it's the tour of the police department and detention center. And then we're mixing it up a little bit. We're having lunch with the 3 finalists. I've asked another community police chief to come. Our nonprofits will also be here. And Dr. Brower from a behavioral health perspective will also be here. And we'll have an informal, relaxed lunch with all 3. And then, of course, we move into the community forum. And then I will bring back 1 or 2 on Monday, and we'll have a decision. I'll call the mayor and Mayor Pro Tem, and we plan on making an announcement on Wednesday.
Oh, thank you. Happening fast, but good. All right, anybody have any comments on that or questions? All right, and then there is no legislative update. The business before the Broomfield Urban Renewal Authority or the Arista Local Improvement District Board of Directors, and there are no special reports this evening. The final item under business for council's consideration this evening is Councilmember Lindstedt's request for future action regarding municipal campaign finance reform. Before I ask Councilmember Lindstedt to provide a brief summary of his request, I want to remind council that this is not a discussion on the topic, and instead an opportunity for council to provide staff direction on whether or not council desires staff to dedicate time and resources to this request. So basically what we're looking for is a thumbs up or thumbs down if we want to advance this for future action. Instead, the opportunity for council to provide staff direction, I already said that. So Councilmember Lindstedt, take it away.
Thank you, Mayor. Yeah, this is something I wanted to bring up in 2019, and then the pandemic hit, and then we were in the middle of elections. So I got this request in as soon as the election was over, with the intention of us having a study session, hopefully sometime, or like spring next year, sometime to discuss it. I know former council member Beacom tried to adjust reporting deadlines a few years ago, and there's been a lot of discussions over the years, but I think it's just something we finally need to do and update, whether it's more transparency, contribution limits, eliminating filing loopholes, whatever the things are. But I think we need to have a proper study session after hopefully a staff review of our current rules and the best practices that other municipalities utilize. So that's my request, is sometime in the next, first half of next year to have a study session on improving our municipal campaign finance system. So that's it. Thank you.
Thank you, Councilmember Lindstedt. So what we'll do now is anybody opposed to advancing this toward a future study session? All right, seeing none, we'll go ahead and move that into advancing it for a study session. Maybe something in the focus session. I don't know how fast that's going to be, but just a thought. Yeah. All right. Thank you, guys. Well, that concludes the items on this evening's agenda. Is there any other business to come before the council? Being no further business, the council meeting is adjourned.